Hello and welcome to Your Health in Your Hands. I'm Dr. David Ajibade with the Brain and Body Foundation. We have a very special guest tonight, a very good, close friend, longtime friend of mine. We're going to be talking about mental illness and crime. Now, mental health I don't want to call it a buzzword because it's a lot more serious than that, but it is sweeping all over the world, especially after the pandemic. We've seen massive increases in all kinds of mental health conditions, everything from suicide ideation to depression to loneliness to increasing crime as a result of mental illnesses and so on and so forth. So it's very important that people first of all, realize that this is a real thing. And also, where their loved ones are concerned, be aware of certain characteristics, signs, and symptoms so that they can be more apt or more quick to seek for medical attention on behalf of their loved ones or push their loved ones to seek attention. Because folks, mental illness is not a good thing. So if you can catch things early, I'm speaking as someone who also treats dementia. If you can catch things early, same across the board, no matter what it is, a stitch in time saves the nine. It's always good to catch things early so you can nip things in the bud and keep them from progressing further and further and further. And speaking of further, without further ado, I want to say a big welcome to Dr. Ajileye, my good friend. Welcome to the show, sir.
Thank you, Dio, for having me again on your show. It's my pleasure to be here to share some knowledge about mental illness and crime.
Absolutely. All right, let's know a little bit about you, what you do, and I know you're into all kinds of things, but just give us a synopsis of what you do before we get into this.
Okay, thank you. Yeah, well, I'm a medical doctor first and foremost, and I specialized in psychiatry. So I'm currently working as a consultant psychiatrist in Birmingham, West Midlands, United Kingdom. I work specifically in acute care, whereby we are in the front line of managing acute illnesses. So we see new cases, new onset, mental disorders and mental illness. And of course, we do see relapse cases as well. In addition to my work as a consultant psychiatrist, I do work as a forensic and legal physician with West Midland Police. And in that interface, we are able to work between the thin line between law and mental health. And where people do commit crime and they get into the criminal justice system, they require our expertise and our advice on how to manage that situation. I'm also serving currently as president of Ibadan College of Medicine Alumni Association, United Kingdom and Ireland. And I'm pleased to do all that in my day-to-day living.
That's amazing. That's amazing. And of course, I forgot to mention that we studied medical school together in the University of Ibadan. So thank you for what you're doing to support our alumni around the world. God bless you, sir.
You're welcome.
All right, mental illness, big topic. Where do we start now with regards to mental illness? Don't worry, some of it will be cut out. So what's a good place to what's a good place to start?
Well, obviously, mental illness is a global phenomenon. As you know, WHO defined state of health as not just the absence of disease, physical health, but the presence of mental well-being is part of what WHO consider as health factors. So it cannot be separated from physical health. A lot of people place a lot of emphasis on physical health, but you have to understand that when somebody is impaired in their mental health functioning, there are other day-to-day activities of daily living is impaired. The ability to go out and work to earn income, the ability to look after their families, the ability to participate in society is impaired. The ability to make informed and important decisions is impaired. Ability to sort of, help themselves as an individual is impaired. The ability to contribute to the society can be impaired. And there's also some degree of dangerousness that could be associated with people with mental illness. I think that's part of what we're going to be looking at today. So how mental illness interplay with dangerousness of crime in our society.
That's right. And just to quick, before we get into the crime aspect, it just occurred to me too that the number one cause of disability in the world, what prevents people from, as you say, engaging in society, going to work, providing for the needs of their family, is a mental illness known as depression. Is that still true?
It's still true. Depression can take away a lot of ability and functionality from an individual. Obviously, yeah. A depressed mind is an inflamed mind. So personally, they're suffering. When we consider the concept of inflammation, it's a combination of pain, it's a combination of disability, and it's a combination of poor quality of life. So when people are depressed, they have impairment of their day-to-day functioning. They're socially withdrawn. They are not able to manage their biological functioning. Even productivity in terms of sexual libido is impaired. People often take a lot of time off work. Therefore, their productivity in that line of work is impaired. So a lot of people also are not able to, make important decisions about, what to do with their lives, what to do with their children. So there's so much that depression takes away from people, and that is a loss to the world or to whatever society they belong to. So depression has been known to take to represent 60 days out of work, in a year for most of people. And you can imagine what 60 days means, in a particular environment. Imagine we are doctors, for example. If I take 60 days from my duty line, it's going to affect a lot of things. It's going to affect, what I do. My patients' care will be impaired, and even ability for the workplace to plan around, and get, support, maybe disorganized as well. So you can see that depression is one mental illness that takes away a lot from people of our society.
That's right. There's a quote I remember. It says, depression, first of all, maims the mind, then it kills the body. It maims or paralyzes the mind, and then it kills the body. I mean, it kills, like you said, procreation, the bodily processes, and so on and so forth. Okay, great. So we know depression is one thing, but depression doesn't drive people to commit major crimes, which is what we're about to talk about now. What's that? We know mental illness can cause a whole variety of crimes, and this is an area that you are intimately interested in, intimately involved in. So let's get into that. Let's see in what areas are we looking at? Maybe without going into too much scientific detail, but let's talk about the connection between mental illness and crime.
Yeah, thank you. People should not associate mental illness with criminal behavior. I think it's important for people to understand that not everybody with mental illness or diagnosis of mental illness will go ahead to commit crime. So there is a misconception that people who have mental disorder of one form or the other are prone to committing crime. However, there will be some percentage who would go ahead and commit crime. And how the law deals with them when they become a mentally disordered offender is different. And perhaps we will talk more about that. There are some aspects of mental illness that makes people more likely to commit crime. And when we talk about crime, where you break the law, for example, stealing, for example, or breaking into people's properties, criminal damage of people's property is a crime. You're breaking the law. You're taking things that doesn't belong to you. So that it could be petty crime, but it is still a crime. You've broken the law. And commonly people with drug addiction will go ahead and do that. So there is a criminal aspect of people, who are drug addicted, people who would go because they need to get a fix for their drugs, go and steal people's properties and go and sell them to get a fix.
So that is not as okay, because I'm trying to differentiate criminal behavior as a result of necessity, because people could easily just as well steal because they're hungry. And that will not be classified as a mental illness aspect. People are going to steal because they need a fix. They're desperate to have a fix. Or, as opposed to people who is just like something in their brain is off, which is now driving them to commit these criminal behaviors. Shouldn't we separate the two?
Yes. Well, there's a way we can separate the two, but in the face of it, once a crime is committed, before, it's the police that will, say that this is a crime. So it is the law that will now say that this crime was committed by somebody who's mentally disordered. Because when somebody is stealing, for example, you don't know whether they have mental illness or not at that time. The police will come there because a crime has been committed. The law has been broken. Then it's when the police takes them to custody, and assess them. That's when they will see that this person has got a form of mental illness, or perhaps the alleged crime may have been committed because of some mental disorder. Okay, so when people go and commit crime, at that point you don't know. Okay, it's different from somebody who commits fraud. Fraud is also a type of crime, but there's a type of crime that people with mental illness are more likely to, they are more prone to commit. And that's the example I was trying to say. Like, breaking into people's property, criminal damage. I mean, a lot of people who with drug addiction are more likely to cause criminal damage because they want to steal to go and, feed their drug habit. So, of course, if they're arrested, it's a crime. They've committed it. They will be arrested because they've done that. There are, people who have postnatal depression, who have killed their own children. Not because they want to kill their children, but because their mind at that time was not in a good state and they're unwell. And therefore, they've killed their children. And there's a reason why they will do that. Many of them may feel that, the baby is a demon or the baby is a threat to them. They cannot recognize that this baby is their own anymore. And because of postnatal depression, they're not able to bond or connect with the baby to provide love for the baby. Some people might have even what we call parapsychosis, a state of mind in which they believe that, the baby, has a very, they have a delusional ideas that the baby is dangerous to them and they have to kill them. Some mothers will smother their baby to death, not because they want to do it, but at that state, they don't have good mental health. They have postnatal blues, postnatal depression, parapsychosis. I mean, there are other, type of people who have serious mental disorder or serious mental illness, who would go and commit, crime, who would go and commit grievous bodily harm. Maybe because they're experiencing delusions or they're experiencing hallucinations, particularly command hallucinations. When people begin to hear voices commanding them to do things that they're not able to resist, that pain, and they have to go ahead and do it. I mean, it's been said before that, somebody has, had what we call a primary delusions that tells him that, anytime the green light turns red, it means that he has to kill like 3-4 people. And they would go ahead, take the gun, go on the street, and then once they see the light green turn red, they just shoot and kill people. Do you understand? When they ask them, they say, sorry, it's because that's the instruction they're getting, that anytime that light turns red, you have to obey that instruction. That's what you need to do. Otherwise, the world is going to come after you. So they're very paranoid. In order to protect themselves, they go and kill, people. We have known people who have stabbed, other patients or other people, because they're responding to some delusional or psychotic symptoms. I have a particular patient who decapitated his housemate. They live in a, high multi-occupancy, sort of house. And he cut off the head of this man, and he called the police himself and said, oh, I've just killed this person. Police didn't believe it. And if they got to the house, they found a headless body, and they searched, and it was leaking the blood. I remember going to see him. They took him into custody. That's when I went to see him, and I couldn't even assess it because it was so disorganized. It was leaking the blood. He called the police. They took him away from there. They found the head somewhere else. This man has paranoid schizophrenia. Now, that is not to say that every patient with paranoid schizophrenia are likely to commit such heinous crime. But there are some of them who perhaps in the state of relapse will go ahead and commit crime because they are here, they're having command hallucinations that's telling them to do it, or they feel threatened, that other people may want to harm them. Therefore, they need to act fast, and defend themselves. So you find a lot of people with those kind of mental illness carrying weapons around. I know patients who have come to my clinic with knives in their body. And when you ask them, why are you carrying knives? Carrying, sharp objects in public is an offense in the UK. They're already breaking the law by carrying it out of their property and putting it in their body. So if the police happen to stop them and search them, they found knife on them, that's a crime on its own, let alone using the knife to do something. Now, for them to put the knife in their body, imagine if they are threatened or they are challenged by, ordinary member of the public. Some of them might just walk up to somebody and say, why are you talking about me? What have I done to? Why are you talking about me? And, the member of the public is not really talking, but because of their paranoia. And they may feel that, that person, innocent person, is a threat to them. And if they carry weapon or gun, they will use it. So in that situation, they would have committed crime, isn't it? So,
okay.
So it's not all patients, I have to say, it's not all patients with paranoid schizophrenia diagnosis or a mental disorder of that nature who do that kind of crime. But there are some of them, who would commit such crime. I'm just trying to establish the kind of crime, that people with mental disorder will commit. You understand? So, but it's interesting that we're talking about this kind of crime, but there are other types of crime that, our politicians do commit nowadays. I've written about this thing before. When people go and steal a large amount of money, and they keep stealing. And maybe what does one person want to do with 1 billion of public money, and they keep stealing and they don't know how to stop? Some of those people, when you assess them, they definitely have an underlying obsessional compulsive disorder. They're compulsively stealing, what they don't need, and they keep hoarding this money. It's a form of crime. When they catch them, or they're caught, some of them might, when they have an assessment, they may be able to say, this is the problem they've got. And many of them cannot even explain why they do it. And when you ask them, what do you need the money for? They don't know. But many of them have underlying mental illness. They have obsessional compulsive disorder. So some kind of mental health disorder are associated with some type of crime. So, for example, if somebody is got mania, bipolar affective disorder, and they're experiencing a manic episode, they are more likely to do crimes like driving recklessly. Do you understand? I mean, I've seen a patient who's shouldn't be driving. They've been banned from driving, and they're experiencing manic episode, and they get into a car and they drive and they kill, members of the public. Of course, the police, that situation will call the attention of the police. They will take them to custody, and a crime has been committed because, number one, they're driving without permission, they're driving without insurance. They've used that driving to recklessly kill members of the public. That's a form of crime. Now, how the law will now deal with them is a different thing. Maybe we can talk about that later. But at the point, we're just talking about crime now, and what does it mean, and what type of mental disorder would make people commit crime. But as I said to you, not all manic patients will go ahead and do it. Not all manic patients, or all psychotic patients will commit a form of crime. I've seen a patient who, in the state of mania, this gentleman was working, with a company, and he took 45,000 pounds from company money. He went on the train and he gave it out to people. He dashed the money out on the train, to different people. Cash money. He was working.
Maybe it was
money. No, it was just money. It was money. So even the money, he didn't use it for himself. Who does that? Who goes take cash and then begin to flitter it around? Obviously, he was in a state of mania at the time. So obviously, they cannot really punish him for that. So anyway, so people have some type of mental illness that makes them more likely to commit a type of crime. People with psychopathic disorder, psychopathic personality or disocial personality or antisocial personality, that are more likely to commit, crime as well. Criminal damage, harm to other people, grievous bodily harm, and all those kind of things. These are the kind of crime that are commonly, associated with people with different kinds of mental health disorder.
Oh, let me jump in here. Let me jump in here and ask a question, because you've kind of like you've talked about quite a few. We've talked about OCD as obsessive compulsive disorder, manic depression, paranoid schizophrenia, which is the more aggressive or the violent kind, psychotic patients, psychopathic personality disorder, and of course, the sociopaths, what are known as the sociopaths as well. Are those, but question number one, are the sociopaths and the psychopaths, the difference between the two? And I'm going to assume that both can drive you towards criminal behavior. Then my other question is, because I want to try and see how we can make this practical for our viewers, are there certain things that make such people have these conditions? Are there certain environmental situations? Okay, we know drugs can do it, but what other things can drive people towards this kind of mental illness, and of course lead from then on to criminal behavior? Are there things that we can avoid? Obviously, we want to know about things, about the signs and symptoms to help us alert us that someone close to us has this mental illness. That's another thing. We want to be alert to know what are the signs and symptoms. But like I said, the other question is, what are the things that make them end up with these conditions? Is it just genetic problems, or are there some other behavioral things that can add to it? I know I'm throwing a lot at you now, so
I know that's an interesting question. That's a very big one as well.
yes.
We're talking about etiology of various types of mental illnesses. A lot of the disorders of mental disorders have genetic predisposition. Oftentimes, when we are doing our assessment, we often ask about family history of mental illness. It's always a brother, an uncle, or a first degree relative, or second degree relative, or identical twins, or some, sort of family members who have had some mental health diagnosis or disorders in the past. In the Western world, some people don't even know their family. Some people are adopted, so they really cannot trace, their family history, let alone know whether there's a family history of a type of mental illness. But generally speaking, yes, a majority of those disorders like depression, bipolar, schizophrenia, anxiety disorder tend to have, genetic loading.
So there's nothing we can do about that to prevent it from happening then?
There's nothing one can do about that, because that is the individual's sort of imprint. That is their own, sort of makeup. You cannot, no one can choose their own genetic composition. You understand? It's only when you are born and you begin to live life that all those things begin to find expression. However, there are some modifying factors. Nature, nurture, environment also can make people, express those, illnesses or symptoms much earlier. For example, if somebody has been exposed to adverse childhood experiences like trauma, sexual abuse, physical abuse, emotional abuse, parental neglect, violent, parental relationship, dysfunctional family, they're more likely to present with mental signs of mental illness early in life. Okay, because these are all, psychosocial stressors, that sort of derail their normal maturation of their brain. So even though they may have genetic predisposition, it will, with all those secondary epigenetic factors, they're more likely to present with mental illness or mental disorder early in life. Okay, and also, other external, factors like drugs and alcohol, illicit drugs, abuse of cannabis. These are stimulants. They produce excessive dopamine in the brain, and dopamine is the main, biochemical factors responsible for psychotic illness. So people who uses a lot of, dopaminergic illicit drugs like cocaine, hallucinogenics and things like that. Obviously, those kind of exposure of the brain, or particularly developing brain, So those kind of things will make people develop mental disorder. And there are some of them that you cannot really explain why. I mean, we have seen people who have negative life events, maybe a relationship breakdown, significant setback in life, maybe failure of exams or having to repeat a class. Some people are not able to adjust, to those kind of negative life events, and it's stress, and that stress can tip them over, even though they may have, genetic predilection. It will tip them over, and they will manifest mental disorder, which will need some form of treatment. So there are multifactorial, genetic and epigenetic factors that science and studies have shown make people more prone to developing those mental illness. But by and large, in clinical practice, we are not looking at, finding, because we cannot change some of those things. Some of those factors can be modified, some of them are non-modified. So we focus on intervention and treatment.
Okay. So, folks, we've been talking about mental illness, mental health, and criminal behavior, and this has been a fascinating talk, really. So the connection between mental illness and criminal behavior, which includes stealing, petty thefts to actual murder, and as Dr. Olayiwola said, decapitation of someone who lives in your home with you. We have to end it here, but we are definitely going to continue this conversation, because I really, you pointed out a few things like dopamine. A lot of these illicit drugs raise dopamine. People are going to ask, how does that lead to criminal behavior? Does it reduce their inhibitory tendencies and make them more like godlike, delusional, like, and say, I can do anything and no one can touch me, kind of thing? We have to get into that some more. So, folks, we're going to end this now, and then we shall come back in not too long from now to continue this discussion. Dr. Lai, thank you so much for joining us. Any final words?
Well, thank you for having me, and I'm sure we've learned one or two things from the conversation today. I'll be happy to elaborate a bit more in our next, episode.
Awesome. Thank you so much. Well, folks, join us next week. Remember, you can watch these videos on our YouTube channel, Dr. David Ajibade. Now, excuse me. You can watch this on our YouTube channel, Brain and Body Foundation, and also on our website as well. So God bless. Take care. See you soon. Bye.
Thank you. Bye-bye. Bye.